Hi, everyone. My name is Lena Saleh from New York City. And I oversee the program planning unit within the prevention program. So just to give an overview of what I'll be talking about, basically the three main components of our HealthHIV funded project. First is building capacity for fourth generation testing and 3-site screening for STIs, as well as addressing the social determinants of health, and then our community engagement that we've done. So first talking about building capacity, what we've done through HealthHIV funding is directly fund 3 non-clinical CBOs to provide HIV prevention and care, navigation, and linkage services. And because New York, is made up of the 5 boroughs, and each of the boroughs have their own distinct feel and vibe, we really wanted to focus on one borough. So we picked Brooklyn, and and all of our services are focused on Brooklyn, though we do acknowledge that a lot of men from Brooklyn do travel to Manhattan to get services for a variety of reasons. So the 3 non-clinical CBOs were funded for STI screening and lab-based HIV testing, navigation to PrEP and PEP, as well as care services, and referral to social and behavioral health services. This is New York City's overall approach to PrEP and PEP navigation. It's a client-centered approach. Everything is couched within within prevention navigation, and the navigators are really what drives the delivery of our services. And the services that we offer are outreach, or that funded agencies offer rather, are outreach, testing, assessment, so intakes, PrEP and PEP education, linkage and support, PrEP and PEP clinical services, as well as other medical services such as vaccinations. And so again, the non-clinical CBOs were providing lab-based 4th generation HIV testing, as well as 4th generation point-of-care testing, confirmatory testing, as well as STI screening. So this is an overall, our overall flow. It's busy, so the only thing you really need to focus on are the areas that show where this is happening, and some where the different screenings are happening. So the STI screening for folks who are positive, and that can happen in the field or at the brick and mortar, as well as the 4th generation HIV testing or the lab-based testing, both of which can happen in the field, and of course at the brick and mortar, as well as the 3-site testing, STI testing for those who are negative. And so we specifically, of the 3 CBOs that were funded, 2 of them specifically did not have capacity to provide lab-based 4th gen screening. And we really looked for agencies, and there was a preference shown to agencies who were not able to do that, because we wanted to build capacity for those agencies to do it. So the way that we did it was peer-to-peer mentoring with agencies that have that capacity. And that really was to build to introduce new diagnostic methods, such as 4th gen HIV screening, as well as to really introduce these new testing technologies. So it was a phone call between Mount Sinai, the agency in New York City, one agency that provides lab-based testing and 3-site screening, with 2 of the funded contractors that don't have that capacity. And so, and Mount Sinai was really just sharing best practices and things to consider when developing your own your own program for delivering lab-based screening. And so things that, they brought up to keep in mind are, do you need a limited lab license? Are you able to find storage and refrigeration for the samples? Is there a space to do the testing or the screening in private? If you're doing STI screening, and we do self-swab STI screening, are you located close to a bathroom if you're trying to do these services in the field? So these are all things that these agencies were keeping in mind when developing their own program, and to varying extents, they've been successful at launching these initiatives. So so that's one piece of it. The other piece of it is really addressing the social determinants of health. And we know that, that HealthHIV, the project, supports HIV prevention and care services, clinical services, but in all our listening sessions, and data demonstrates that sexual health is really one of the priorities, but not the most important priorities that folks mention when considering the things that are going on in their lives. So we knew it was really important to address these, such as employment, housing. In New York, housing is a major, major issue. as is I'm sure in other jurisdictions, education, substance use, mental health services, legal services, food, and immigration status. And so what we did was as part of the agency's work, we actually supported direct funding for linkage, for screening for behavioral health and social support services, as well as funding to support linkage to these services. And this can include a warm handoff, really just ensuring that clients are able to get, in addition to their HIV needs, they're able to get these other behavioral health and social service needs. And of the funded agencies, one of them is able to provide multiple of these behavioral health social services, and the other is not, so linkage out. And we recognize, again, employment as being one of the major barriers to, or one of the major social determinants. And so we developed, this workforce development initiative, and it looked at addressing employment needs of HIV negative and positive persons. There are a lot of resources available for those who are HIV positive, not as many for those who are HIV negative. And so it really focused on amping up and bolstering what we had for HIV negative folks. And we partnered with our care and treatment program to build a robust service. And so the activities of the workforce development included educating providers about workforce development and vocational rehabilitation services through webinars and workshops that were offered, as well as creating resources to assist providers in making referrals to such services. And a big part of this had to do with, we know what we don't know, and so a lot of it was building partnerships with workforce development providers in New York City, contracting with consultants. So we reached out to the Mayor's Office of Workforce Development, the New York City Workforce Development Board, and all these other agencies that are listed. And we've had two events, workforce development events, and that were specifically for community. And then we have another, or for providers rather, and now another one coming up in a couple of months, I think, on conducting a community-facing employment resource fair. And then our last piece is the community engagement. And so this was really focused on trying to get more meaningful engagement with the community. There's a lot going on in New York. And so trying to get folks to come to an event, it's really, it's a tall order. And so it needs to be, lessons learned. Our first community, our first listening session preceded June 2016, and we had maybe 10 people show up. So we realized that, we're not reaching out to the right people, and we really need to focus our efforts. And so in June 2016, we had a love, sex, and PrEP listening session. And participants mentioned, facilitators and barriers to accessing services. And again, as I mentioned earlier, the HIV is not the most important priority. And then just last summer, we had a Wild Thoughts community listening session. This is the flyer that went out, and it addressed various social determinants of health. And we had it in a club, made it fun, and we had a much better turnout. And these are some of the quotes of participants at the listening session. Again, kind of the main themes being that HIV is not the most important priority, that location of services is important, deciding whether to stay in Brooklyn to get services, or, you're concerned that people will see you, and so you go to Manhattan or you go to the Bronx or whatever, is an important consideration. And then we also developed a community advisory board composed of community members and providers, and they meet monthly in Brooklyn to really inform the development and implementation of our activities, the Project Thrive activities, and how to improve engagement. And this is something that we realized after the 10 people showed up at that first listening session that we need to learn. And so they've really informed how we can reach those people that are not connected. Because there's always the folks that come to all the events, and we're happy to have them, but we want to be able to reach the people that are not connected to the servers, to services. So not those who are in addition to those who are in the Kiki scene and show up at the drag events. And so our CAB really analyzed and utilized information from the listening sessions. They would go through the transcripts and to build a list of recommendations and an action plan of how to improve services through the Thrive project. And the action plan aims to increase awareness of and access to holistic HIV prevention and care services. And the focus specifically is on expanding behavioral health and social support services. And lastly, we've been able to hear what other jurisdictions are doing, and to us that's super exciting, such as like the Baltimore project, the storytelling project, and what we just heard about the 41st dates, which I thought was super cute, as well as the Game Changers project. So there's a lot to learn out there, and we're really excited to do it. Thank you.